And thank you for joining us for this important town hall on insulin affordability. We're very, very pleased today to have you all participate with us and learn more about this important topic. I'm delighted to kick this off by introducing U.S. Senator Alex Padilla. Senator Padilla is California's junior senator. He's the proud son of immigrants from Mexico and attended Los Angeles public schools. He is a California man. He is a graduate of MIT, where he earned a Bachelor's of Science degree in mechanical engineering. He serves as the chairman of the Senate Judiciary Subcommittee on Immigration, Citizenship, and Border Safety. He's also a member of the Senate Committees on Budget and Environment, Public Works, Homeland Security and Governmental Affairs, Judiciary, and Rules. Before becoming a member of Congress, the senator served as California's first Latino Secretary of State and was a state senator. Senator Padilla is also a past chair of the Los Angeles Community, or the American Diabetes Association's Los Angeles Community Leadership Board. Today, he lives in the San Fernando Valley with his wife and their 3 sons. Welcome, Senator Padilla.
Well, thank you, Lisa, and thank you everybody for joining us today to talk about the important conversation about not just bringing down costs for working families, but bringing down specifically the costs for essential medical care. Before I get into the topic of today, I know we have viewers from throughout the state of California, so I just wanted to take a moment to acknowledge that, yes, I and my office are aware of the shelter-in-place order in and around the UC Berkeley community. So if there's anybody that's joining us from that region, please, we ask that you continue to heed the advisories of law enforcement until we learn more about the situation and everything is cleared to be safe. With that, just wanted to return to the topic at hand and say that I'm proud to be a longtime partner of the American Diabetes Association. As Lisa mentioned, back in 2005, when I was serving on the Los Angeles City Council, my involvement as a volunteer and as an advocate with the Los Angeles Leadership Council, including serving as a chair of the local council. Soon after that, I was elected to the California State Senate. That was in 2006, and it should surprise no one that the very first law that I introduced and was eventually signed called on the state of California to be the first state in the nation to require chain restaurants to post calorie information directly on menus and menu boards in an effort to address the growing rates of obesity and diabetes by giving individuals and families the tools they needed to make informed decisions when eating out. Menu labeling, yes, California was the first state in the nation to adopt the law, was later included in the Affordable Care Act and is now national policy. So my involvement has been for a long, long time, and I got involved in the cause because of my own personal connection to the issue and to diabetes. Yes, diabetes runs in my family. Not just cousins and uncles and aunts, but my mom worked hard to manage her type 2 for many, many years. And many times it was a struggle. It was a challenge. I'm happy to share that publicly because we need to talk about it more. But also I know that our family is far from alone in managing diabetes. In fact, more than 3.2 million Californians are living with diabetes and rely on insulin to survive and maintain their quality of life. Diabetes is especially common and prevalent in Black and Latino communities. And that's why lowering the cost of prescription drugs is so critical. Affordable healthcare too often is a question of life and death. No person should have to ration their insulin or any other drug because of the cost. And no parent should have to debate a trade-off between paying the rent or the mortgage and paying for insulin that keeps children safe and healthy. That's why I'm proud to be a co-sponsor of the Affordable Insulin Now Act. Together, working with my colleagues in the Senate, we'll be introducing a bill that would require Medicare and private insurers to cap out-of-pocket insulin costs at $35 per month. Today, Californians with diabetes spend collectively $39.5 billion every year just on insulin. That's just on insulin. So we're working to bring down the cost of insulin and other prescription drugs and other medical care to help put money back in the pocket of working families, because at the end of the day, healthcare is not a luxury. It is a human right. And families are already feeling the impact of higher prices in other areas, including the gas station and the grocery store. At the same time, corporations in a number of sectors are taking home record profits. So now is the time for Congress to act to put a stop to outrageous prices for insulin that millions of patients depend on to survive. And before I turn it back to you, Lisa, I know we're getting ready for a great dialogue here, but I did want to offer a few words in Spanish for our Spanish language media and our Spanish language audience. Gracias por acompañarnos hoy. Este tema es no solo importante, pero personal para mí. La diabetes corre en mi familia y sé personalmente que el impacto de diabetes en la persona y en la familia tratando de manejar esta condición. Y sé que nuestra historia, la historia de mi familia, no es único. La diabetes es especialmente común en las comunidades afroamericanas y latinas. Y es por eso que reducir el costo de los medicamentos es tan importante. La atención médica accesible y acostable es una cuestión de vida o muerte para muchos. Y ninguna persona debería tener que racionar su insulina debido al costo alto. Es por eso que apoyo el proyecto de ley para controlar el costo, los precios de la insulina en cual muchos dependen. Queremos controlar el precio y reducir los costos para californianos y pacientes a través de todo el país. La atención médica no es un lujo, es un derecho humano. Y seguiré trabajando para reducir el costo de la insulina, los medicamentos y otros cuidados médicos para devolver el dinero a su bolsillo y a poder ayudar a salvar vidas. I want to thank all the advocates again here today to share these updates on insulin costs around California, and look forward to hearing from our great panel. Lisa, back to you.
Thank you. Thank you so much, Senator Padilla. It's really my pleasure now to introduce today's esteemed panelists. We have Dr. Francisco Prieto, who has practiced in California for more than 30 years. He's currently the chair of the American Diabetes Association's National Advocacy Committee. And prior to that, he served on several other important committees within ADA, including our Diabetes Disparities Action Council, and he was the president of the ADA in the Sacramento Sierra Community Leadership Board. In addition to his role at ADA, Dr. Prieto has served on the board of the California Institute for Regenerative Medicine, and he has done that for more than 16 years, representing diabetes. He's a practicing physician with the Sutter Medical Group and is also an assistant clinical professor at the University of California, Davis. He received his Bachelor of Science with majors in biology and history from the University of Illinois in Chicago, and he received his medical degree from the University of Minnesota. Michele Lew is our second panelist. She is the CEO of the Health Trust. She has a BA in economics from Yale University and a master's in public policy from Harvard University. Michele has focused her 20-plus year career on addressing racial inequities in health. Since 2018, she's served as the CEO of the Health Trust, a nonprofit operating foundation with more than $130 million in assets focused on building health equity in the Silicon Valley. The Health Trust serves as a grant maker, direct service provider, and policy advocate. Michele formerly spent more than 10 years as the CEO of a San Jose, California federally qualified health center specializing in primary care, behavioral health, and social services for Asian immigrants and refugees. Thanks for joining us today, Michele. We look forward to your presentation. And also we have we're honored to have Dr. Francine Kaufman. She is the Chief Medical Officer of Sensonics, Inc. Previously, she was the CMO and Vice President of Global Clinical, Medical, and Regulatory Affairs at Medtronic Diabetes, during which time the first automated insulin delivery system was commercialized. She's also a Distinguished Professor Emerita of Pediatrics at the Keck School of Medicine at the University of Southern California and prior division head of endocrinology at Children's Hospital Los Angeles. She's authored more than 290 peer-reviewed and invited articles and is the author of numerous books, including Diabesity. She has received numerous grants, including being funded by the NIH for over 3 decades, and she was elected to the National Academy of Health and of Medicine in 2005. Dr. Kaufman is also a former president of the American Diabetes Association nationally, and she has been very involved in diabetes advocacy, directing camps in Southern California, Ecuador, and Haiti for more than 30 years. She's been a lifelong partner for me in advocacy and has been instrumental in passing legislation mandating coverage for diabetes equipment and supplies, ensuring students with diabetes are safe at school, and banning sodas from the Los Angeles Unified School District and school campuses nationwide. So welcome all of our esteemed panelists, and we'll begin, Dr. Prieto, with you. We've seen historic movement around insulin affordability, and we would love it if you could share with our audience a little bit more about how that's unfolded.
Thank you, Lisa. And I also want to thank Senator Padilla and your staff for holding this town hall. Gracias por su servicio. I've practiced family medicine in the Valley for over 35 years. And because of the genetic predisposition to diabetes that so many of our people have, this has been California's own version of the diabetes belt, and it has been ground zero for the diabetes epidemic. For more than the last decade, one of the most frequent complaints I've heard is not just how my patients are feeling, what we should be talking about, but that they can't afford their insulin and their diabetes supplies and other medications. So the ADA is very pleased that so many people in and out of Congress are paying attention to insulin affordability now, but we've been working on this issue for over 5 years. We convened a working group of experts and stakeholders who released a white paper on policy recommendations on insulin access and affordability. ADA experts and people with diabetes and parents of children with diabetes have testified before Congress, before state legislatures. We've pushed for insulin copay caps and have now had those adopted in 20 states and the District of Columbia. We've worked with the administration, with the Bipartisan Diabetes Caucus, other members on federal policies to impact a greater number of people in need. Besides supporting the insulin affordability provisions that were in the Build Better Act, we have endorsed the Affordable Insulin Now Act that Senator Padilla mentioned, and we strongly support the Congressional Diabetes Caucus proposal that includes reforms to insulin rebates and a $35 monthly copay cap on out-of-pocket costs for patients for their insulin. We support this legislation because it puts patients first, which is in healthcare what we should always be doing. Our main objective is for people with diabetes to pay less at the pharmacy counter for the insulin that they need to live. 1 in 4 insulin users have reported that they can't afford their medication and they ration or skip doses so that they can afford other life essentials. So we at the ADA think the Diabetes Caucus plan is a good, thoughtful approach. It targets multiple drivers of the cost of insulin. It holds both drug manufacturers and insurance companies accountable for higher costs. And I'd like to make one final point. Insulin is not a new treatment or drug. It was discovered and isolated from animals over 100 years ago. And for many years, for decades, we used animal insulin from slaughterhouses to treat diabetes. The last major innovations in insulin happened in the 1970s when scientists figured out how to make an exact copy of human insulin, and in the 1990s when the insulin analogs were developed. There's no good reason for insulin to be so expensive, and it has only happened because we've put systems in place and incentives in place that have distorted the market. And I think Congress can do something to fix that. Thank you.
Thank you, Dr. Prieto. Michele, welcome. The Health Trust has been such a great partner for the American Diabetes Association on the issue of insulin affordability, and we're glad to have you here today. So I'll turn it over to you.
Thank you so much, Lisa. And I first want to thank Senator Padilla for sharing his family story with diabetes. His story actually made me remember a day a few years ago when my son came home from middle school and found his dad, a type 1 diabetic, on the ground, unresponsive, suffering from low blood sugar. And everybody's okay now, but like the senator, insulin affordability, it's really close to home. So I am Michele Lew, CEO of the Health Trust in San Jose, California, in the heart of Silicon Valley. And we know that some people think Silicon Valley is all Teslas and billionaires, and that's partially true, but the reality is that 1/3 of households in Silicon Valley don't make enough to fulfill their basic needs. At the Health Trust, we want everyone in our community to be as healthy as possible, regardless of their income, their zip code, their race, their gender, etc. As we've heard, the majority of Californians either have diabetes or pre-diabetes now. Here in our county, Santa Clara County, while only 10% of the population is diagnosed with diabetes, 1 in 2 county residents have pre-diabetes. And diabetes doesn't affect everybody in our county equally. We're seeing a higher percentage of Latino, African American, and also Vietnamese adults being diagnosed with diabetes compared to the white population. And while the gender breakdown of folks with diabetes is similar between men and women, we are finding that women are more likely than men to ration insulin due to the cost. Nearly 40% of Americans don't have enough savings for a $400 emergency, and the average cost of insulin is about $450 a month. So the question for all of us, I think, becomes how much is the cost of insulin preventing Americans with diabetes from acquiring savings for emergencies? Those emergencies could be a pandemic or a financial crisis caused by a pandemic. And how much is the cost of insulin keeping individuals with diabetes in poverty, especially in areas like Silicon Valley, where the cost of living is so high? For us, access to affordable insulin means that individuals will be better able to regulate their diabetes. They'll be able to fight illnesses better and prevent or delay long-term health consequences that accompany diabetes frequently, such as vision loss or even amputation. By capping insulin prices, people with diabetes will not only live longer lives, they'll live fuller and healthier lives. Here in Silicon Valley and our work at the Health Trust, we hear the stories of real-life residents who are making that gut-wrenching choice between buying insulin, paying rent, or putting food on the table. We can, and in fact, we must fix this problem, and that's why we're so glad that Senator Padilla is leading the way for us. Thank you, Lisa. I'll turn it back to you.
Thank you so much. And before I transition to Dr. Kaufman, I just want to send a reminder, please put your questions and comments in the chat box and we'll begin to address them. All right, without further ado, Dr. Kaufman, we will welcome your remarks today.
Thank you, Lisa. And I'm just so honored to be here today with all of you, and particularly with Senator Padilla, who I did work with decades ago on some of the issues that are so close to his heart, including diabetes. And his real interest in diabetes came through so early, not only for his own family, but his constituents and obviously for all Americans. So thanks for all that you've done, Senator Padilla. And so many of you are aware of what I want to talk about, which is what have we learned about diabetes from the COVID pandemic? We know, we saw in the paper all the time, articles, one after the other, of the more grave outcome if somebody had pre-existing diabetes or were diagnosed at the time of a COVID infection with diabetes. Much higher need for hospitalization, much higher complication rate, and particularly mortality. 40% of the people who died with COVID had diabetes or glucose dysregulation. And 1 in 5 individuals who were hospitalized with diabetes and COVID died within 28 days of that hospitalization. But, you know, it turns out it's not all equal for people with diabetes. And one of the factors that we know is a particular risk is when somebody has poorly managed diabetes. Their glucose levels have been high for a while. Other metabolic factors are at play that involve some of the other vital systems, particularly the cardiovascular system. And as a result of that, compared to somebody who is well managing their diabetes and has their glucose ranges and these other metabolic factors relatively close to the ideal, those who have been poorly managed are where the excess issues really occur. And 42% of those individuals, when they were hospitalized with COVID, died, compared to those well managed when hospitalized with COVID, only 14% died. So then we have to step back and say, well, why is somebody not optimally controlled when they know they have diabetes and they know they must manage their glucose value? Well, there's a myriad of factors that lead to that, but one of them, and maybe the most important one, is affordability of the medications and particularly of insulin, because all type 1 patients need insulin, but by the time somebody with type 2 diabetes is likely on insulin, they're far down this disease paradigm. So we need to look at what does it mean to not be able to access enough insulin. And we've quoted, but the study was done by a group called DQ&A with association with the American Diabetes Association in 2020, and surveyed 5,000 individuals with diabetes and asked about insulin rationing. And 25%, so 1 in 4, said that they had been rationing insulin during the COVID pandemic. So what does that mean? Skipping insulin doses, taking less insulin. What does that lead to? High glucose values, metabolic dysregulation, and all the risk of needing to be hospitalized, having complications, needing ventilators, and having an excess of mortality. And I know this personally as a physician in Southern California, not far from Alex's original district, and working at Children's Hospital, where we do take care of not only children, but young adults. And I had a young adult patient who had just finished graduate school, and this guy's going to be a star. But in the midst of the COVID pandemic, he didn't have a job. Although he was still on his parents' insurance, he was now responsible for managing his budget for the first time, something that's not so easy to do. And he could not figure out how to afford getting enough insulin, paying his rent, and buying food. So he started rationing his insulin. And when I saw him on a virtual visit and could see that he'd lost weight and looked at his glucose numbers, and they were significantly out of where the range they should be, he finally admitted, and with immense shame, that he was rationing insulin. He was missing doses, maybe 3 or 4 a week. Each other dose, he was taking maybe 20% off so that he could stretch out each bottle of insulin to last longer because he couldn't afford it. So I'm just so glad that there's massive efforts to address the affordability of insulin, and something that could lead to the end of insulin rationing. So thanks for allowing me to be part of today's event.
Thank you, Dr. Kaufman. And I'm going to turn it over to Edgar Rodriguez.
Thanks, Lisa. And hi, everyone. At this point, we'll transition to some Q&A. So if you please can submit your questions in the chat box, we'll go ahead and do about a couple minutes before we have to wrap up here. So we'll give folks about a few seconds.
Dr. Prieto, I see a question from Carl Dinwiddie, who's asking, will this legislation address the issue of insurance companies, not doctors, determining the best brand of insulin for patients?
So yes, the Diabetes Caucus proposal does address this. We don't have exact language for that bill yet. There are a couple of different bills. Those of you who know the legislative process, you know, there have been bills passed in the House. There's an identical bill and a new proposal in the Senate. Eventually, those will have to be, brought together and passed with the same language. But yes, we do expect to address this issue, as well as address the factors that make insulin so unaffordable for people who are still uninsured.
Great. Seeing no further questions, I think we can go to closing remarks. And I just want to remind folks, we'll be sharing a copy of the recording so you can have for your records afterwards. So turn it back to you, Lisa. Thank you.
Thank you so much. I'll invite Senator Padilla to make closing comments.
Great. Well, first I want to thank you, Lisa, and our three panelists for a great discussion. For those who tuned in, we had only one question, which means I think we answered a whole bunch in the course of the conversation. It's good to be with all of you in this virtual roundtable session. And as you heard, the high cost of insulin affects countless Californians in very real and profound ways. And not just the 3.2 million Californians who live with diabetes, but by extension, their families, their friends, and their communities. When I referenced my mom earlier, right? We all have a personal connection, whether we realize it or not. We learned quickly that it wasn't just about making sure that mom got the care that she needed and what it meant for her diet, what it meant for her physical activity, but what it meant for us as a family. And so just think of the millions and millions of families in California alone going through that same experience, and for that matter, across the country. So the time is now, given where we are on the diabetes front, where we are with pre-diabetes, where we are with the impact of COVID, and where a lot of families are in their home economics. So we must take action now to lower the cost of insulin, because it is literally life-saving, essential medical treatment. And so that's why I'm a proud co-sponsor of the Affordable Insulin Now Act on the Senate side. As Dr. Prieto mentioned, we'll get a Senate version through hopefully in the near future, reconcile it with the House version that's been approved, and get something to the president's desk. The American people deserve no less. And I'm confident this will get done, because I'm proud to once again work alongside the American Diabetes Association in advocating for this bill. Together, we'll get the bill done, and we'll continue working together to raise awareness about diabetes, and improved treatments and therapies will lower the cost of life-saving healthcare, and look forward to staying together in this fight. Thank you, Lisa.
Thank you so much, and thank you for elevating this issue. The American Diabetes Association has made this one of their top priorities. We simply cannot have 1 in 4 families fighting to stay healthy with diabetes and make ends meet. So we appreciate your championship of this issue and support, and we look forward to having continued progress on this issue in Congress. So thank you all for joining us today. Thank you, my esteemed panelists, and look forward to connecting with you all in the future.